Let's discuss the Chinese and Western medical thought. Evolution of TCM theory, part 2. The first serious challenge to ancient Chinese medical theory was influenced by philosophical trends similar to those associated with the logical positivism in Karl Popper in Vienna. Like the logical positivism, the Western-trained scholars like Yu Wan deemed unobservables in Chinese medicine as metaphysical and hence meaningless. They regarded Chinese medical theory to be unfalsifiable and therefore unscientific. In defense, Chinese physicians cited extensive historical clinical records of successful treatments using Chinese medicine. In addition, they appealed to the authority of ancient Chinese philosophy on which medical theory was based. The clinical record of Chinese medicine was difficult for Western doctors to dismiss, as many of them acknowledged the widespread existence of prima facie evidence of the efficacy of some Chinese medications and of acupuncture. But they insisted that the efficacy of Chinese methods were subjected to formal testing in accordance with the rigors of Western scientific tradition. As to invoking the wisdom of an ancient philosophical system to justify medical theory, this convinced few detractors, as it was seen as merely shifting to the burden of proof from medicine to ancient philosophy and implicitly admitting its scientific inadequacy. Following Mao's decision to modernize Chinese medicine, the first national textbook for instruction in TCM appeared in 1958 entitled Outline of Chinese Medicine. Subsequent texts covering different subjects within medicine displayed deliberate similarity to their Western counterparts, and they constituted a massive and unprecedented systematization of Chinese medical theory and practice. Regulations of TCM practice was introduced through the licensing of medical practitioners at the state level with common national examinations. Since modernization, the TCM universities in China have required about 30 to 40% of students' time to be spent on studying Western medicine. Graduates can practice basic Western medicine in addition to TCM. They can read modern diagnostic test results, prescribe Western drugs, and perform simple surgical procedures. Research publications in TCM have yet to catch up in terms of rigor and methodology with those in the West, but their increasing numbers and improving quality attest to the recognition by TCM scholars that their theories and therapeutic methods should be put to test similar to those used in evidence-based medicine. Referring to the systematization of Chinese medicine, Sieben opines that such change had been most decisive over the past generation with unmistakable influence from modern medicine. Shed notes that the transition was not without its controversies and contends that despite the apparent uniformity forced upon the TCM community by state-sanctioned textbook and clinical practices, there remained a plurality of views among scholars and practitioners. Shed observation especially pertinent considering that conservative scholars like Lu Lihong continue to regard the classics as the ultimate authority on modern despite their formal training in TCM as the modern systematized from of Chinese medicine. They treat TCM as the product of adulteration and distortion by Western interpretation. Such conservatives seems to be a dying breed. As much as the systematization of Chinese medicine was considered a radical transformation in the 1960s, the truth of the matter is that Chinese medical thought was largely stagnated since the emergence of the Nijing, as if time was virtually stood still after the theoretical breakthroughs of the Han Dynasty. Indeed, generations of modern scholars of Chinese medicine have continued to treat the Neijing as the source of all Chinese medical wisdom. Among conservative scholars, the presumption is that the ancient were gifted with special powers of discernment, which allowed them to use ultimate truth in medicine and record them accurately in the classics. Understanding this ultimate truth would be all it takes to grasp the truth of Chinese medicine, although an enormous amount of scholarly work was to be invested in interpreting these ancient writings, not unlike research on ancient scriptures. Thank you for your attention.
We continue with interviewing techniques. This time, we ask about energy levels. It is important to remember that fatigue can be not only a deficiency condition, but also an excess condition. There are, however, fundamental differences in the underlying dynamics of the two types of fatigue. There are also significant differences in when and how the fatigue manifests. In a deficient state of fatigue, there is a genuine deficiency of energy in the body, which makes the person feel tired. The fatigue will last all day, become more apparent as the day goes on, and will usually be worst in the late afternoon and evening. The fatigue will also be worse after physical and mental activity or exertion, because the physical and mental activity will consume the person's qi and make their deficiency greater. It is, however, important to be aware that the person might feel refreshed and more energetic immediately after physical activity. This is because the physical activity has created movement, thereby circulating and activating their qi. The fatigue will, though, resurface and be greater later on that day or the day after, as they have drawn on their reserves. When there is fatigue, it is also important to determine whether the fatigue is due to an actual deficient condition or whether the person has unrealistic expectations with regards to how much energy a person should have. It is not uncommon for a person to complain that they feel tired or exhausted, but when questioned, you discover that they are constantly physically and mentally active from early morning to late evening, and they sleep too little. These patients are qi deficient, but their qi deficiency is the consequence of unrealistic expectations of how much qi the body is capable of producing, rather than an imbalance in one or more of the qi-producing organs. When there is an excess condition manifesting with tiredness, it is not because there is insufficient qi. The tiredness arises because there is something that is blocking the qi, so it cannot circulate around the body, resulting in the person experiencing fatigue. In these cases, the fatigue will be worst in the morning. This is because the person has been physically inactive all night, and their qi has therefore not been circulated by the body's natural movement. This means that they feel tired and find it difficult to get going in the morning. Once they have been up and about for a while, the body's natural movements help to circulate qi, and the tiredness is reduced. Fatigue due to excess conditions will also be relieved by physical activities such as running, biking, yoga, chopping wood, and so on. They will, on the other hand, feel more lethargic and fatigued if there is a lack of physical movement. There are differences not only in the overall underlying mechanisms of deficient and excess tiredness, but also in the mechanisms within the two groups themselves. These differences mean that there are some characteristic signs that can be asked about when differentiating the various imbalances. Now let's discuss qi deficiency fatigue. Qi deficiency fatigue arises when not enough qi is produced to carry out the various processes in the body. The person may well feel tired already when they wake up in the morning, either because there is not enough qi or because their qi deficiency means that qi and blood have a tendency to stagnate due to a lack of propulsion. This condition is then exacerbated when the person has been inactive all night and the circulation of qi has not been assisted by the body's physical movement. The vital difference here between them and a person who has a pure stagnation condition is that the fatigue worsens as the day goes on and is aggravated by activity and exertion. A person with spleen qi deficiency will often feel tired after meals, especially after eating a lot or eating rich food. This is because large or rich meals place a greater burden on the spleen qi when the spleen transforms the ingested food into ku qi. The weakening of spleen qi will also often give rise to the emergence of dampness, which blocks the pure yang qi from ascending upwards, whilst blocking the shen, so the person becomes drowsy and lethargic. Yang deficiency fatigue. One of the tasks that yang performs is to activate the body. When there is yang deficiency, a person will experience both physical and mental lethargy and fatigue. They will lack a fundamental sense of enthusiasm and motivation. The difference between qi deficiency fatigue and yang deficiency fatigue will be apparent in the other signs and symptoms. Yang deficiency conditions will simultaneously manifest with signs such as an aversion to cold limbs, and so on. Yang deficiency fatigue is sometimes more apparent in winter, the most yin period of the year. The person may also suffer from winter depressions. A man with kidney yang deficiency will feel more fatigued after he has had sex or ejaculated because he loses both kidney jing and kidney yang on ejaculation. This is also the reason that many men fall asleep immediately after sex. Thank you for listening.
Let's continue with mutual consuming of yin and yang in our continuing discussion of the 4 principles of yin and yang. From a pathological point of view, there can be 4 different situations of excess of yin or excess of yang, leading to consumption of yin or yang, respectively, or to consumption of yang or consumption of yin, leading to apparent excess of yin or yang, respectively. It is important to note that excess of yang and consumption of yin are not the same. In excess of yang, the primary factor is the abnormal increase of yang, which leads to consumption of yin. In consumption of yin, the primary factor is the deficiency of yin arising spontaneously and leading to an apparent excess of yang. Here is a bar graph showing the balance of yin and yang. Here is another bar graph showing an excess of yin, where yin is above the normal level or in excess and yang is in deficiency. An example of this is when excess cold, be it interior or exterior, and there is an excess cold in the body which consumes the yang, especially spleen yang. This is a case of food cold. Here another bar graph showing the state of yin and yang in an excess of yang. An example of this is when excess heat consumes the body fluids. This excess heat can be exterior or interior, and where body fluids pertaining to yin, and if there is an excess heat, it can lead to dryness. This condition is Phlegm-Heat. Here is a bar graph showing a consumption of yang, where yin is still in a normal level and yang is deficient. So let's talk more about consumption of yang. This takes place when the body's yang energy is spontaneously deficient. The decrease of yang energy leads to cold, chilliness, and other symptoms, which to a certain extent are similar to those created by excess of yin. The situation is, however, very different, as in excessive yin, it is the excessive yin that is the primary aspect and which consumes yang. In case of consumption of yang, the decrease of yang is the primary aspect and the yin is only apparently in excess. This is called empty-cold. In consumption of yin is deficient and yang still in normal level, but in apparent excess relative to yin. So let's talk more about consumption of yin. This takes place when the body's yin energies are depleted. The decrease of yin yin will lead to symptoms of apparent excess of yang, such as feelings of heat. Again, this situation is very different from that seen in excess of yang. In excess of yang, the excess of yang is the primary aspect. In case of decrease of yin, this is the primary aspect, and the yang is only apparently in excess. This is called empty heat. The distinction between empty cold and full cold, and between empty heat and full heat, is all important in practice. In case of emptiness, one needs to tonify, while in cases of fullness, one needs to expel pathogenic factors. So to summarize, mutual consuming of yin and yang, heat and cold. If there is an excess of yang, or excess of yin, it's fully cold. If it is an excess of yang, it's full heat. If there is consumption of yang, it's empty cold, and if it is consumption of yin, it is empty heat. Thank you for your attention.
Let's discuss the extraordinary yang organs, the brain, part 2. The brain controls intelligence. In chapter 17 of the simple question says, the head is the palace of intelligence. Palace here, the who could also be translated as yang organ. Thus, in a similar way as in Western medicine, the brain controls intelligence and mental clarity. Many of the functions that Western medicine attributes to the brain are attributed to the heart in Chinese medicine. The heart houses the mind, which is the Shen, which is responsible for thinking, memory, perception, etc. However, during the course of development of Chinese medicine, too, there have been doctors who attributed mental functions to the brain rather than the heart. In particular, Sun Si Miao of the Tang Dynasty, Shao Yu Qin of the Yuan Dynasty, Li Shen of the Ming Dynasty, and especially Wang Qinren of the Qing Dynasty. For example, Li Shen said the brain is the palace of the original Shen. Wang Qinren said specifically the intelligence and memory reside not in the heart but in the brain. Thus, the brain controls intelligence, memory, thinking, and consciousness. This is not in contradiction with the heart being responsible for those functions. It simply means that there is an overlap between the heart and brain with regard to those functions. However, in clinical practice, the relationship between the heart and functions, such as intelligence, memory, thinking, and consciousness, is more important than that of the brain. Indeed, what it actually means in practice is that in order to stimulate those functions, one can use points from the heart channel or from the governing vessel on the head that act on the brain. So for the clinical note, to stimulate the brain, it's necessary to tonify the kidneys with kidney 3 and bladder 23, and the governing vessel with Do20 to 16. The brain is the sea of marrow and controls sight, hearing, smell, and taste. Ancient Chinese medicine books relate the functions of sight, hearing, smell, and taste to the sea of marrow, that is the brain. Chapter 28 of the spiritual axis says, when the qi of the upper part of the body is insufficient, the brain is not full and there may be hardness of hearing, tinnitus, drooping of the head, and blurred vision. Wang Qinren was even more explicit. The two ears communicate with the brain, and therefore hearing depends on the brain. The two eyes from a system like a thread that connects them to the brain, and therefore sight depends on the brain. The nose communicates with the brain, and therefore smell depends on the brain. In small children, the brain grows gradually, and that is why they can say a few words. Therefore, the senses of sight, hearing, smell, taste, and function of speech all depend on the brain. So for the summary function of the brain controls intelligence. The brain is the sieve marrow and it controls the senses of sight, hearing, smell, and taste. Thank you for your attention.
We continue with treatment principles, this time treating manifestation first and the root later. Under certain circumstances, the root becomes secondary and the manifestation needs to be treated first and usually urgently too. This approach is applicable in all cases when the clinical manifestations are very severe or even life-threatening. This is especially common in acute cases. For example, a patient has a productive cough with profuse watery sputum, breathlessness, chilliness, a thick sticky coating, and a slippery pulse. The clinical manifestations reflect spleen-yang deficiency, the root, causing retention of phlegm in the lungs, the manifestation. In this case, if the clinical manifestations are severe and acute, particularly in an elderly person, the correct approach is to deal with the manifestation first by resolving phlegm and stimulating the descending of lung qi. Later, when the symptoms of phlegm have subsided, one can treat the root, that is, tonify and warm the spleen. Another example, a woman suffering from dysmenorrhea caused by stasis of blood, itself caused by deficiency of qi. In this case, the correct approach is to concentrate on treating the manifestation, that is, move blood and stop pain before or during the period, and in treating the root, that is, tonify qi, just after and in between periods. So the strategy of treating the manifestation first and the root later is applied when the former is producing severe and distressing symptoms, which need to be addressed urgently, often in acute cases. Dispelling the pathogen prior to strengthening the vital. This method is applied to the syndromes of excess of pathogenic qi with deficiency of vital qi, where the pathogen should be eliminated urgently, but the vital qi can still withstand the attack. Under this circumstance, pathogen should be eliminated first by purgation, followed by regulation and tonification. For example, consider blood deficiency caused by blood stasis, metorrhagia, and metastasis. If blood stasis continues, metorrhagia and metastasis cannot be stopped, and blood deficiency will worsen. So, blood stasis should be dispelled by invigorating the blood and tonifying the blood afterward. Thank you for your attention.
Let's continue with diagnosis according to Zanko organ patterns. This time we discuss phlegm-heat in the lung. Phlegm-heat in the lung will often have developed from other lung imbalances. Damp phlegm in the lung can easily transform into phlegm-heat in the lung because either there is already heat in the lung or the stagnation that is created by the phlegm will generate heat in the lung. The difference between this pattern and damp phlegm in the lung is that there are heat symptoms and signs. The pattern of lung heat can also be a precursor of this because heat in the lung can condense fluids and thereby lead to the formation of phlegm heat. It is important to note that phlegm heat does not necessarily sticky. This is due to the heat condensing fluids so that they become thick and sticky. When the phlegm is yellow or greenish, the heat will be more intense. Now let's take a look at its etiology. Phlegm heat in the lung can arise if there is an excessive consumption of foods that create phlegm or heat. Example of these foods are dairy products, sweets, sugar, alcohol, wheat, fried food, too much red meat, spicy food, and chocolate. Very cold food and beverages or raw vegetables can be involved indirectly because they can weaken spleen-yang and qi, thereby leading to the creation of dampness and phlegm. Invasions of exogenous pathogenic qi can create both phlegm and heat in the lung. Air pollution, especially tobacco smoke, can be an important etiological factor. This is seen in many people who smoke tobacco developing a smoker's cough, having difficulty breathing, and easily becoming breathless. Stress can create heat in the body, and emotions such as anger, irritation, and frustration can generate heat in the liver that then rises to the lung and creates heat here. So what are its symptoms and signs? There is loud and noisy cough with sticky sputum and cough that is worst in the mornings. There's yellow or greenish sputum. The sputum can also sometimes be white, but it will not be watery or loose as the sputum is thick and sticky. There may be blood in the sputum. There's chest oppression, a sensation of heavy weight or a stone lying on the chest. There's shallow breathing or wheezing and shortness of breath or slight breathlessness. There is also a gravelly or hoarse voice, phlegm in the throat, thirst, a foggy or heavy sensation in the head, especially in the morning. There's aversion to heat, lips, red tongue with thick sticky yellowish coating, and fast, slippery, and full pulse, especially in the right lung position. The key symptoms here are loud, productive cough, shortness of breathing, yellow, sticky tongue coating. For the treatment principle, we drain phlegm and heat from the lung and regulate lung qi. In our acupuncture treatment, we can choose from lung 1, lung 5, lung 7, lung 10, LI11, UB13, DO12, DO14, stomach 40, and REN 17, and use the draining needling technique. A further explanation on the choice of points. Lung 1, lung 5, and UB13 regulate lung qi and drain phlegm and heat from the lung. Lung 10 and DO12 drain heat from the lung and regulate lung qi. Lung 7 and REN 17 regulate lung qi. LI11 and DO14 drain heat, and stomach 40 transforms phlegm and opens the chest. A relevant advice for a person with phlegm heat in the lung should also avoid consuming food that creates heat, dampness, and phlegm. This includes dairy products, sweets, dried fruits, sugar, alcohol, fried food, chili, pepper, garlic, chocolate, and lamb. Smoking should be discouraged, and the person should avoid other forms of air pollution. Phlegm heat in the lung can be caused by the following patterns of imbalance: damp heat in the lung heat, spleen qi deficiency, and invasion of exogenous pathogen qi. In turn, this can result to spleen qi deficiency, blood stagnation, lung yin deficiency. To summarize, phlegm heat obstructing the lung has its etiology in an invasion of exterior heat depressed in the lung and transforming into heat, internally produced heat from yin deficiency or qi stagnation from long-term emotional strain, excessive consumption of greasy and cold raw foods. The possible presenting conditions are bronchial asthma, acute bronchitis, pneumonia, pulmonary emphysema with infection. Its signs and symptoms: cough and panting, barking cough with profuse sticky yellow or green sputum, shortness of breath, sweating, flaring nostrils, expectoration of blood and or purulent phlegm with fishy smell, wheezing, feeling of oppression of the chest, feeling of heat, thirst, insomnia, and agitation. The pulse will be slippery and rapid, and the tongue red, swollen with a sticky yellow coating. For the treatment principle, we clear and drain phlegm heat. And for our acupuncture treatment, we can use the following points: lung 5, which clears heat and phlegm; lung 10, which clears lung heat; bladder 13 supplements lung qi; stomach 40 resolves phlegm; LI4 releases the exterior; stomach 36 transforms phlegm; lung 7 restores lung descending function; lung 11 clears lung heat; REN 12 supplements spleen and resolves phlegm; lung 1 descends lung qi and alleviates cough; REN 17 unbinds the chest; kidney 6 disinhibits the throat. We needle these points with drainage and we prick LI1 to bleed. Thank you for your attention.
Let's discuss diagnosis according to 8 principles. Heat, part 2. Exterior excess heat. When there is exterior heat, there will be signs relating to the disturbance of weight chi or to the muscles and joints such as in B syndrome. The only lung organ that can be affected immediately by invasion of excessive in the exterior is the lung. This is because exterior evil heat will disrupt the functioning of Wei Qi, which is controlled by the lungs. When there is exterior excessive, there is no disturbance of other internal organ physiology. The pulse will be superficial and rapid because evil Qi is in the exterior and because there is heat. If there are any changes seen on the tongue, this will be visible on the tip and or the sides, which will be red, and there may be a thin yellowish coating in these areas. Exterior heat symptoms and signs will be acute. Interior heat symptoms and signs will be more chronic in nature. But there may be acute episodes. This is often on aversion to wind and cold during an exogenous invasion of heat because Wei Qi is disturbed. This will not be the case when there is a condition of heat in the interior. On the contrary, the person will often have aversion to heat. The thirst will not be as strong as there is heat in the exterior. This is because heat is starting to injure the body's fluid, but not to the same extent as when there is heat in the interior. So we have here the differences between interior and exterior heat. For the interior heat, most often chronic, but there may be an acute episodes. For the exterior, it is acute. For the interior heat, may be due to one or more of the 6 climatic forms of evil Qi, the 7 emotions, and diverse causes. For the exterior heat, it is due to one or more of the 6 climatic forms of evil Qi. For the interior heat, can be deficient or excess condition, while in the exterior heat, it is an excess condition. For the interior heat, it affects the sunk organs, while the exterior heat, Wei Qi, muscles, joints are affected. For the interior heat, there is disruptions of body's internal physiology. For the exterior heat, the body's internal physiology is not disrupted. For the interior heat, the pulse can be deep or superficial, while the exterior heat, the pulse is superficial. For the interior heat, the entire tongue can be red, or the tongue can be red in an area that corresponds to a specific organ that is affected by heat. There can be both a yellowish coating or a lack of coating, depending on whether it is an excess or deficient condition. For the exterior heat, the tip and the sides may be red, and there may be a thin yellowish coating in these areas. For the interior heat, there is no aversion to wind and cold, while sa exterior heat, there is slight aversion to wind and cold. For the interior heat, there may be a strong thirst, while exterior heat, the thirst is not so pronounced. There is a rapid body movements for the interior heat, while for the exterior, normal body, it is a normal body. There is normal body movement. For the interior heat, there is rapid and verbose speech, while for the exterior heat, there is a normal speech. For the interior heat, Shen may be affected, while exterior heat, Shen is not affected. There may be bleeding for the interior heat. In the exterior heat, no bleeding. For the treatment principle of the interior heat, either drain heat or no Shen, while for the exterior heat, we have to expel wind heat. Let's go to the etiology. Excessive can arise in several ways. Excessive intake of foodstuff, beverages, and spices that have a warm or hot energy. Typical example of these are chili, garlic, pepper, alcohol, lamb, fried foods such as chips, falafel, crisp, and so on. This will be especially relevant when there is heat in the liver, stomach, and intestine. Prolonged emotional imbalances like stress, frustration, and anger will create heat in the heart and liver. Smoking tobacco creates heat, especially in the lungs. Invasion of exogenous evil Qi, heat can directly invade the body. The invasion can be via the exterior or directly into the interior. Invasion of exogenous food can transport into heat in the interior. Internally generated evil Qi, such as dampness, can transform and become damp heat. For the symptoms and signs, there is thirst, aversion to heat, skin may feel warm when palpated, the face can be red or woody, discharges and exudations that have changed color and become yellowish or greenish. There is excretion that have become sticky or thickier. There is excretion that smell or taste strongly. There is pain that is throbbing, stinging or burning. There is excessive sweating or lack of sweating. There is constipation, red tongue, and rapid pulse. The key symptoms we have to observe is the thirst, aversion to heat, red face, red tongue, and rapid pulse. For the treatment principle, we have to expel or drain heat. Thank you for your attention.
We discuss etiology of depression. Emotional stress is the main etiological factor in depression. The main emotions that may give rise to depression are anger, sadness, grief, worry, and guilt. Anger, intended in a broad sense to include frustration, resentment, and hatred, causes either liver Qi stagnation or liver Yang rising. When it is suppressed, it is more likely to cause liver Qi stagnation and depression. Liver Qi stagnation is a frequent cause of mental depression, especially in its beginning stages. Liver Qi stagnation causes depression by restraining the coming and going of the ethereal soul, therefore resulting in a lack of ideas, projects, aims, inspiration, and a general lack of sense of direction in life. One of the most significant and important signs of liver Qi stagnation is a wiry pulse. If the pulse is generally wiry in all positions, it is always a definite sign that the mental depression is due to liver Qi stagnation. Often, the pulse picture contradicts the first appearance of the patient. In fact, the patient may appear depressed, slow in movement, and pale with a weak voice, all signs pointing to a deficiency as the cause of the problem. But the pulse is full and wiry in every position. This is a sure sign that the depression is due to Qi stagnation. In some cases, especially in men, the person may seek treatment for tiredness as his main complaint. But if the pulse is full and wiry in every position, it almost certainly indicates that the person is depressed with liver Qi stagnation as the main cause of it. Sadness and grief initially deplete Qi and therefore lead to Qi deficiency of the spleen, heart, and lungs. However, after some time, the deficiency of Qi impairs its circulation and leads also to some Qi stagnation. This is a Qi stagnation that affects not the liver, but the heart and lungs. So here we have the schema of the effect of sadness and grief. The heart and or lung Qi stagnation also affect the ethereal soul and restrain its coming and going, resulting in lack of ideas, projects, aims, and inspiration, and a general lack of sense of direction in life. Sadness and grief are frequent causes of depression from loss of a family member or partner through death or separation. This is called reactive depression in Western psychiatry. Worry knots Qi, which means that it causes Qi stagnation. Worry causes stagnation of Qi of the spleen, lungs, and heart. Worry also affects the liver and may cause either liver Qi stagnation or liver Yang rising. The heart and or lung Qi stagnation also affect the ethereal soul and restrain its coming and going, resulting in a lack of ideas, projects, aims, and inspiration, and a general lack of sense of direction in life. Thank you for your attention.